What's patient-centric care? Well, to me, it just means bringing everything together, technology, everything we know about medicine to help people stay healthier.
That means having all doctors on the same page, collaborating, and keeping the patient informed so that they feel like they are important.
Patient-centered accountable care is basically looking at what the patient needs as opposed to how the patient fits into our systems of care, and we haven't not looked at it that way. Some patients need just some preventive services and do very well with that alone. There are others who have tremendously complex diseases, and we need to spend a lot more time and attention looking at both their medical needs and their social needs. And we have to be responsible or accountable for the outcomes of those interactions.
William J. Mayo said, "The best interests of the patient are the only interests to be considered." And in order to heal the sick and advance the science, a union of forces is necessary. When you really think about that statement, that is patient-centered accountable care. Now the American Medical Group Association is positioned to really live those principles and use those principles to design a new model of care for America.
I'm starting to feel so much more confident because I see that my doctors are sharing information and that everybody is on the same page.
Specialists and primary care physicians, internists, pediatricians, and family physicians have worked together in multi-specialty groups for years to better coordinate care and to see that the patient sees the right provider at the right time for the right reasons.
I'm the CEO and head of HR. I need healthcare to be affordable, and I need my employees to be able to see the doctors that they want. That way we both win.
There's not one model of care that will work across the country or will work for all provider groups or patient groups. The idea here is that the government, through our payment systems, Medicare and Medicaid, will work with the healthcare sector, our business community, our payers, and also work with patients and families who rely on the healthcare system every day.
We need the federal government not to become the primary payer for everyone's health care in the country, because he who pays gets to decide. Instead, we need government to provide a framework in which all of us can work successfully.
Here's the key. As long as we are all willing to work together towards this, and as long as we keep the doctor and the patient at the center of our thoughts, as long as the regulations are written with the patient and the doctor in mind, I think we come a lot closer toward achieving that goal.
As we think about healthcare, the challenges that face family physicians and their colleagues in the specialty practices, other specialty practices at an individual level will be immense. We need to understand that our value to the system is in ongoing management of patients, meeting their best interests. And the implications of that, of course, are that we need to understand and adapt our best interests to serve their best interests.
This is a remarkable time for physicians in particular to drive the change that needs to occur out there. We need physician leaders in order to make sure that that change that occurs is something that is workable and that is constructive. The physicians are in the ideal situation right now to make that happen.
Let's do it. Let's lead that change. This is the time, and we are the ones to do it.